Welcome back to our Citizens Crime Watch podcast. I'm glad all of you are back here again this month with us. I am your host, Joe Bermudez. Today we are very privileged to have a very good friend of mine. I don't want to say, I try not to do this because I know I do it every podcast. I date myself, and I'm not going to do it for her because, you know, wonderful person here. But a very good friend of mine, Major Melissa Barosela from, let's see if I get this right, because she just told me the newest update to the name, the Mental Health and Wellness Bureau.
Yes.
I got it. I knocked it out of the ballpark. You know, I just go easy, psych services. That's what I knew when I was back in my day and stuff like that. But thank you for being here today with us. We really appreciate it.
Thank you for having me.
No, it's my pleasure. So what we're here with our, to tell our viewers and talk to them about one of your fortes, which is mental health awareness, mental health help, all the great things that you and your bureau do for the community and for the department and stuff like that, because it's so important, especially now coming up. We have a month of May is mental health awareness month. Mm-hmm. See if I can spit that out. We feel it's an important topic to get out there and get out to the public and stuff like that. So, but I guess before we dive into what we're going to talk about today, how about you introduce yourself? Because I know who you are. I know how wonderful you are and all the great stuff that you've done, but tell us about yourself.
So I've been with the department for a little over 27 years. Spent the first half of my career, a little less than half of my career in our South District, where I worked different capacities there, uniform patrol, NRU, investigations, and really enjoyed my time there. Prior to starting the department, I received my bachelor's in psychology from University of Florida. So I always had a passion and an interest for mental health. I was actually going to go to grad school right after graduating from UF, but I kind of really felt a calling or really passionate about law enforcement as well. I had done an internship with the Alachua County Sheriff's Office and decided that I was going to put a pause in my education and just go into the police academy. So after graduating, I went to the academy, again, did my time in the district. While I was there, I decided to go back to school, again in mental health. Didn't even know we had a psych services actually when I started the department. Really just wanted to be an officer. Eventually went to negotiator school and learned more about what the department offers with respect to mental health. So again, went back to school, got licensed by the state of Florida in mental health, and had the opportunity back in 2007 to join what was then called the Psychological Services section of the police department. And I've been there ever since. The bureau that section has grown and developed.
Yeah, I remember it was just a small section, yes. And now it's a bureau. You're in charge of a big group of, and a very important part of our department. It's necessary. So,
absolutely. So the bureau originally was just really dedicated to the mental health of our officers. For decades, we've had that program established. It changed, it morphed about a year and a half ago into kind of two branches. So we still have what you remember as psych services, right? So the old psych services that still, again, is completely dedicated to the mental health of our our employees, all of our employees, both the sworn and the civilians. But now we also have the community mental health section, which is devoted to, the mental health needs of the community. So under that umbrella, we have our recently established crisis response unit. We also have our threat management unit that was established in 2018 after the Parkland shooting. So they are also under the Bureau, as well as our victim advocate program and our negotiator program. So it's kind of all things mental health under one.
Taken a lot. Well, but that's good. They've kind of centralized and brought it all together, and you're able to communicate the needs of the community, the needs of our officers, and provide that help, that much needed help that's out there we need to provide. So
definitely a blessing to be able to kind of use both of my education and my police experience to kind of wear both hats every single day. So it's great.
So I guess you kind of told me a little bit, it was your initial love was that mental health. Why I keep saying mental health awareness. Why did you what wanted to make you be a therapist? Why choose that path?
Yeah, I think fell into it. I actually wanted to be a child psychologist back in the day, but again, grew up in a family of law enforcement. So, just kind of being around that, I realized that that's really where I wanted where I saw myself, kind of, again, in law enforcement, but still being able to focus on mental health. So again, got the best of both worlds and didn't even plan it this way.
Awesome. Well, it's good for us. You were able to pause, become a police officer and work with us for so many years and still continue work, and then go back to your initial passion of helping people in that capacity. So it's great. That's great. And we appreciate that.
Thank you.
So you said it's been like a year and a half where the section, and now it's grown, the bureau's morphed into everything that it is now. Have you seen an increase in mental health issues in the last couple of years? Is it something out there, from our police perspective, and also maybe from your personal or your private practice type perspective? Have you seen an increase in that?
Yeah, I think there's definitely an increase not only in the prevalence of mental health issues, but also the seeking services for mental health related issues. So there is definitely an increase, but I think it's both. There is probably an increased prevalence, but people are also on the police side, definitely seeking services more than ever before. So, I think it's a reduction in stigma, on the police side, and then on the other side, I think there's also a shortage of services for people having mental health issues. But there is definitely a huge increase just with our adolescents. It's more than doubled in the past couple of decades.
That's crazy. Don't even get me started on that. I have teenage kids, and my wife and I were just talking about it the other day. It's like, we were sitting there, I have my son's going through getting ready for college now, going through the process and all this stuff. And I'm like, geez, the pressures that these kids nowadays are put under for academics and testing and applying. Also, like we were just commenting about, even applying for colleges. I remember, this is where I date myself again, I remember just going down to the school, filling out a piece of paper, here's my tuition money, when do I start classes?
Right.
That's it.
Right.
Now it's like this competition and submit this and you got to have this and hours and services and it's like,
it's a full-time job.
Yeah, it's crazy the amount of stress that's put on our kids, and not to mention that's just one aspect of it. Now you start talking, from the social media side and peer pressure, like everything they got to deal with nowadays. It's unbelievable. So I can see where there's that increase, and I guess the other thing I'm thankful for is that they're able to. There's more. It's not like a stigma anymore. I don't think, is it?
Right.
I guess people are talking about it more. You see more people looking for help, talking about help, offering help and stuff like that. So it's good that that's out there and stuff. It's
right.
changed.
It's not a taboo topic anymore, And I think the pandemic also changed things quite a bit. We definitely saw an increase in,
No, that was a stressor all on its own.
Yeah, that definitely changed the landscape with mental health. I think that really, unfortunately, impacted so many people negatively, and we definitely have seen a huge increase nationally. In mental health related issues post-pandemic.
Wow. Yeah, I think and probably a lot of it is not to get too much into, but I think it's also, you were people were not dealing with one another. You were cooped up in your house. You're kind of dealing with yourself. And you had to look at everything that was hitting you and okay, there's nobody else to talk to. So you had a lot of people in that situation, but it's unbelievable. But hopefully we're doing our part here, and you're doing your part, and other therapists doing their part to try to help and remedy this and get it, get the situation a little bit better. If we can hope so. So I wanted to pivot a little bit and talk about, because I kind of want to educate maybe our viewers a little bit about, from the aspect of when you call the police, because we talked about these people having, and I'll use the term mental health crisis for, I guess, lack of a better term, but it may not be such a crisis where you see that somebody breaking stuff or really going, losing it. It could be a silent crisis. It could be something of that nature. What does it mean, or what can it mean to be in crisis when someone has to call the police?
Yeah, I mean, it can, like you just highlighted, it can mean so many different things. It depends on the person. It's very subjective. You know, what defines a crisis for one person isn't necessarily a crisis for someone else. And so it can definitely look very different depending on the individual. It could be, again, somebody throwing things, you know, exactly what you just described. And it could also be somebody completely silent, you know, again, can't even get out of bed, can't even, you know, formulate a sentence. And so, you know, crisis looks different, you know, depending on the person and the situation. So it's kind of hard to define exactly what that looks like, because again, it can look like anything really, but it's just when somebody's coping mechanisms are just, they're overwhelmed, you know, their normal coping strategies may not be working at that particular moment. And so, you know, oftentimes they find, or maybe their family members or whomever may be witnessing them, just they have no other idea of who to call other than the police. And sometimes the police are needed, you know, but not always, you know, but again, we know that number 911 since kindergarten, right? So that's usually oftentimes, you know, the police oftentimes become sometimes that first contact with somebody who's having some sort of mental health crisis is, again, with law enforcement. So,
and a lot of times, like you say, like people call the police. It's easy for them to call the police and say, he's losing it. You need to come now real quick. And it may not be that. So they need to know the you know, the options, what they have. And like you said, we may be that first contact, and that's what we're here for. That, you know, 911, you need help, call us and we'll be there. Now, one of the things I remember when I was on the road, I used to handle calls, or you get these type of calls and you respond to people right when you get there, because everybody knows the term Baker Act. You know, it gets thrown around a lot. Oh, you know, he needs to be Baker Act. He's crazy. But there's things that have to be met for someone to be Baker Acted by a police officer. What's like the criteria that we need to find for that?
Sure. Yeah, I think that term is used pretty loosely. You know, but like you said, there is a set of criteria. So the person has to have that mental health or mental illness, you know, as it's defined by state statute. But again, they have to be a threat to themselves or others, or at risk of serious, you know, bodily harm from neglect. Let's say that they just are unable to care for themselves. Again, but where they are at risk of serious bodily harm to themselves or others, not just because they're quote unquote, you know, crazy or whatever words that are thrown out there. So even just a mental health condition in and of itself does not mean that somebody needs to be Baker Acted.
Very good. Yeah, because I remember I was always, you get there, you guys got the Baker Act, and the person sitting there quietly. No, they may be in that crisis, like you said, that quiet crisis, but you can't always do something.
Right.
So
They may need services, but it doesn't mean that they need to be involuntarily hospitalized as a result.
Now, I know one of the things we also used to tell family members, obviously when we got there and they didn't meet our criteria as law enforcement, the family does have options to go to the courts for that, correct?
Yes, absolutely, via the ex parte order. So very similar to, the end result is very similar to a Baker Act in the sense that it allows law enforcement to transport this individual for treatment, again, following the family's petition to the judge. So the end result is the same as far as them getting inpatient services, but the method is different. You know, again, the family will petition for that.
Good. Now, I want to highlight one thing, because it's also something that we dealt with as law enforcement, was the difference between somebody calling, because we would get calls for, you need to take my son and Baker Act him because he's gone crazy, he's on drugs. That's different. Now, it may be a result of a crisis because he's going through something and he's getting involved in some type of substance abuse, drugs or alcohol, but that's completely different than a Baker Act, correct?
Right. So some people have those co-occurring disorders. So they might have a mental health issue and also, you know, a substance use disorder. But when we look at that, that's more what we refer to as the Marchman Act. So, you know, that's for treatment for the substance use disorder, not for the mental health side. So it's, you know, whether it's somebody has lost control because of, you know, their substance use, or they aren't able to determine for themselves that they need treatment because of their level of impairment. That's where, again, a family can petition for that Marchman Act, or an officer, you know, can take them for involuntary treatment under the Marchman Act. Where they end up is what changes. So rather than just a crisis receiving facility, they will end up at a substance abuse receiving facility, because not all crisis facilities, handle
Have
substance
to deal
abuse.
with that.
Right.
And there's a lot more that gets involved when now you're dealing with substance abuse,
Yeah.
especially when you're trying to get them off of it. They have to be prepared to deal with that.
Right, medically,
Yeah,
so you have to
medically.
be medically stabilized, detoxed in a medical environment. So yes, absolutely.
Yeah. Thank you for pointing that out, or the difference in that, because that's something we see a lot. And officers out there can attest to that. You get the call and say, he's smoking weed, he's crazy, you got to take him Baker Act. I'm like, no, that doesn't mean that he's Baker acted because he was smoking some weed, or he's doing some drugs, or he's doing something like that. But obviously, it is a person that still needs help and still needs assistance. And there's ways that we can help, but we got to know which route to take or which way to go and stuff like that.
Absolutely.
So we talked a little bit about, how you can say you can go and get these ex parte orders and stuff through the courts. What are some other resources that may be available out there for family members or someone who's in crisis themselves that they can reach out to if they feel they need help?
Yeah, absolutely. We just definitely have a lot of services out there via, first of all, we have 211, which is...
It's like the county helpline, isn't it?
Yeah, it's basically the county helpline, and again, they can direct the caller to tons of resources depending on their need. They also have 988, which is a suicide hotline as well. We also have Driving Myself Florida basically provides, they're the managing entity for mental health, so they have various community partners and providers in their network that they're able to direct, callers to as well via, again, 211 or 988. And we also have the mobile response team, which has expanded tremendously in the past year. There's now 4 mobile response teams throughout the county, again, funded through Thriving Mind, and they basically will, if you call this number, again, it's 1-800-435-7968, they will respond to an individual in crisis. They have a licensed mental health provider on there, and again, they are able to determine, what level of care that individual might need and help to provide them with those services. We also have NAMI, which is a National Alliance for Mental Illness. That is also another resource for families and for individuals who may need mental health services.
So it's expanded a lot.
Absolutely.
And that is amazing. That is great. Because I remember, there was a time there wasn't many people you could call.
Right.
I think I remember the most was maybe the suicide prevention hotline was about it. And now they even made it simpler. It's 3 numbers.
Yes.
Remember, it was a big, you have to remember the big number now. Now it's 3 numbers, and that's great that they're making it much more simple for someone to call and ask for help. Because that's what it's about, is asking for help when you need it. So, awesome. Thank you very much. And we'll make sure we'll put that in our description, and we'll add some numbers at the bottom as you see coming along, so that you can copy those down and have them as resources for you in the future. And hopefully, knock on wood, there, you never need them. But so let's talk a little bit about. You mentioned a little while ago how the department has grown, or your bureau, shall I say, has grown so much. What new tactics has MDPD taken on to expand their role in mental health awareness and crisis intervention and stuff like that?
Yeah, so they implemented the crisis intervention teams training over 2 decades ago through Hopsy Kaba and her team. They've been providing training for, again, decades now, and it's a 40-hour training that, MDPD anyway, they require that all of our officers go through crisis intervention teams training. So that is, again, mandatory, whether in the academy, right after the academy. Again, we're catching up with some of the COVID classes. The classes went through during the pandemic, but aside from those classes, everybody within MDPD is required to attend that as a bare minimum. We also now have our crisis response unit that I indicated earlier. They again were launched back in May of this year, and the impact that they have had on the community already has been just amazing. Really great group of officers. We have 25 officers and 3 sergeants and a lieutenant who are dedicated to handling just calls for service involving individuals in crisis. So they received an additional 160 hours of training. They were interviewed and were selected for the unit based upon a lot of skills and characteristics that we saw within each and every one of them. Again, then went through the training, and they also have monthly training as well to keep their skill set, very sharp, and learn, as much as we could possibly teach them with respect to, dealing with people in crisis or with mental health conditions. So all they do is respond to these calls for service. They are currently in Northside, Hammocks, and South District, and they occasionally do some details in Intracoastal District as well. But and those districts were chosen because they are the ones that have the highest call volume of individuals who are in crisis or who are in need of mental health services. So they respond together with, they have a licensed clinician that is attached to them, and so they have that ability to, whether it's, have the clinician respond to the scene of whatever incident they might be on. They help them to kind of triage and see whether it rises to the level of a Baker Act, or whether this individual might just need some other assistance or other resources. And we also have two firefighters from MDFR who are also psychiatric nurse professionals attached to the teams. So they too will respond, and they're able to assess, maybe it's somebody just having some sort of diabetic episode, right? Maybe their symptoms are a result of some sort of hypoglycemia or something, and so these firefighters are able to help us in that regard too. They've been amazing. One of them arrived way before fire, and he was able to administer Narcan and save somebody who had overdosed. Again, the collaboration and that partnership with MDFR has been really amazing. So the team is, again, can't speak enough as to just how valuable they have been, and the work that they're doing within the county, throughout the county.
That's awesome. That's awesome. I know that they were, the part of them, I guess, before it kicked off, I remember seeing some of them during Surfside when I was out there. You had some people, your team was very crucial in helping the families of the victims and stuff like that during Surfside. So
so
that was like a big wake up.
Yeah, we had our peer support out there helping initially, and the victim advocates were initially helping the community, and then eventually we kind of transfer our focus over to our actual first responders. So both the officers and the firefighters, we began to really help them throughout that time that we were there in Surfside. So the victim advocates again were critical, during Surfside. As were our police counselors and our police psychologists that are attached to MDPD. And on the community side, we also have our threat management unit. Again, they've been around since 2018, and their purpose really is to avert any sort of mass casualty situation or anything that has that mental health nexus to perhaps somebody is a threat to him or herself or others because of their mental health condition. And so these are kind of like the higher utilizers of mental health services. So individuals who are Baker Acted repeatedly, right, that may need a little bit more attention, or the TMU as we call it, threat management, also are the detectives that will procure for risk protection orders if need be. Again, just to not only keep the individual safe, but our community safe as well. And again, the work that they do is just so critical to the overall mission.
And that's very important because, for so many years, when we see these incidences, these major incidents that happen, it's a lot of times because they slip through the cracks.
Mm-hmm. Right.
So that's amazing that MDPD has taken this on to put together this team to kind of try to avoid that and try for that not to happen here in Dade County. So it's great. So you talked a little bit about, you mentioned there when we were talking about the peer support. So transitioning over to, from the community, because obviously the department's done a lot of stuff since my time for the community, how it's grown. But now it's also transitioned a lot to helping law enforcement a lot more. Right. Like I said, back in my day, psych services. You knew we were there. We really didn't talk to you unless we needed to. Right. Or you were asked to go talk to them or something like that. But we see now that you have these new tactics to deal with stress when it comes to the profession. And you guys developed this peer support group you talked about.
Yeah, so we've really tried to take an approach in the past several years of being just a little bit more proactive and less reactive to things. So whether it's, sometimes it's training, so really developing a lot more training, not the mandated training that no one usually wants to go to, but different types of training very specific to the needs of the officers. We also, again, established the Peer Advocate Program back in just before COVID. So kind of, again, the timing of it was just so optimal. And those are officers who have just an interest in helping their brothers and sisters in the sense that they receive, again, additional training, they're hand-selected, and they are kind of our eyes and ears on the ground. So they're embedded within the districts and the bureaus, the different entities throughout the department, because they're the ones that know, if someone's going through something, or if they recognize, they're trained to look at signs and symptoms of, perhaps somebody who is, struggling or perhaps going down a dark path, and so they kind of, whether they directly will engage with that officer or after, they may refer them to our office if they feel that individual would benefit from ongoing services. And then within the actual office, we have a team of licensed mental health professionals, again, trained in police psychology, who provide the individual counseling, couples counseling, any direct services that the officers need. They're able to come and get professional help.
That's awesome.
From a team, again, all provided by Miami-Dade Police Department.
That's great, and I'm a little biased because I always think our department is the best around, it's the best in the nation. So I'm glad they're doing this. But have you seen, not just, and I don't want to say, because I think our department is really well at this, and I think you guys have done an amazing job at trying to identify this, but because I think I've seen it, there's an increase in mental health issues with law enforcement nationwide.
Yeah, I think that a lot of the issues have always been there as far as it just being a very stressful occupation. The suicide rate within law enforcement is completely unacceptable, and just the numbers are really shocking. It is a very stressful profession. It's not getting any easier in that regard. Plus, officers are human. They go through the same issues as anybody else, and then they have that added factor of the stresses of the job, the things that they're exposed to, the things that they, witness on a day-to-day basis. It's not easy.
It isn't. And it's funny because sometimes I've caught myself talking with friends. You always get, what's the craziest thing you've ever seen being a cop? And you start talking, and a couple of times I've caught myself telling a story, and then I noticed my kids were sitting there, or even my spouse, my wife's been sitting there, and they kind of look at me like, what? Because I've never really shared it with them, and I guess I try to shelter them from the stuff that we see.
Right.
So, but and I'm just telling a friend, it's different telling a friend a story than telling your loved one. So that stress, I've seen them go, now they're listening a little more intent, and they're not aware of the things that we're exposed to, over the years. And 30 years, you see some stuff.
Yeah, yeah, and then like you said, you say it so nonchalantly, and then you don't even realize the non-police officer that's listening to this is thinking what the heck? Yeah.
It's crazy. So I guess just to wrap it up here, I'm gonna tap into your therapist side for a second, because I want to see if you can just, as a therapist, what would you say to someone out there that thinks they need help? What's the best advice that you could give them?
To not be afraid to ask for it. Whether you're in law enforcement or not, you should never have to go through anything alone. People aren't alone, and so there are resources out there, both for officers and for the community. And again, we just have to have the courage to know that sometimes it's okay to not be okay, and it's okay to ask for help. And that really is a sign of strength, to be able to reach out and not just internalize.
It's awesome. Sometimes it's stronger to ask for help than to sit there quietly.
Yeah. So. Yeah, we need to do better. We need to do better for our community, and we need to do better for our officers and continue to provide them, with all the help that they possibly can get.
Definitely. Well, thank you very much. We appreciate you being here today with us and sharing with us. You're always welcome to come back and sit and talk with us anytime you want to share anything. And congratulations to you and the department for everything they're doing for the community and for my fellow brothers and sisters in law enforcement. And I truly appreciate it from the bottom of my heart for everything you do. So make sure you check out some of the information that we put out there. If you ever need help, please reach out to someone, even if it's just calling a friend to talk to them, because you're all important to all of us. So we'll see you next month. And remember, crime prevention starts with you.